Welcome to our roundtable discussion. This is the Living to 100 Club. We're going to be talking about overcoming financial obstacles today. I'd like to open first by welcoming our guests, each of our guests. We have with us Larry Nisenson, the Chief Commercial Officer for Genworth U.S. Life Insurance Business, where he oversees product and business development for Genworth and oversees Care Scout Caregiver Support Services, a unique support program for caregivers. We also have Dr. Peter Lichtenberg, the director of the Institute of Gerontology at Wayne State University, and a clinician who has made contributions to a wide variety of areas with older adults, including dementia, rehabilitation, and a special interest and expertise in financial capacity and exploitation. Also joining us today is Dr. Preston Cherry, the founder and president of Concurrent Financial Planning, serving households and businesses across generational lines. He's also an assistant professor of finance at the University of Wisconsin, an instructor at Texas Tech University, and a board member of the Financial Therapy Association. So welcome to each of you.
Thanks for having us, Joe.
Yes, thank you.
Let me start by reading an excerpt from a blog that I wrote last month about financial obstacles. We've known from the outset of this COVID-19 pandemic that older adults have experienced a disproportionate impact on their health, whether in the form of infection rates, hospitalizations, or death. However, another serious effect of this pandemic has been the loss of income and health insurance and unemployment. The Commonwealth Fund, in an article about COVID-19's impact on older workers, about 11% of ages 65 and over, or just over 1 million people, have lost their jobs, representing about 13% of the older adult workforce. Even higher rates are found in workers of Asian descent, 19%, and Hispanic heritage, also 19%, while furloughed employees approaches 30% for those who worked in the leisure and hospitality industries. So coupling these financial hits with the usual stresses for seniors under non-pandemic conditions, we really have serious challenges for this age group at this time. So our program today addresses these obstacles and looks for solutions.
Great.
So let me open with this first question. From your vantage points, even aside from COVID, what are some of the unique financial stresses often associated with aging? We know things like healthcare costs, fixed income, transition to long-term care, financial fraud. But what are some of these financial stresses that we often see with older adults? Larry, let's start with you first.
Thanks, Joe. And it couldn't come at a worse time for those older adults, right? They are generally on fixed incomes. They're already facing the pressure of escalating costs. Even to your point, pre-COVID, we know that just if you look at bankruptcies, just as an example, since 2013, the number of those folks age 65 and older that have filed for bankruptcy, that number has doubled just in the last 7 years. And the leading cause of it, without any question, has been rising healthcare costs, right? And so when we take that and know that, just to bring caregivers into it with one other statistic, just to sort of set at least the way I view it, right? 50% of those that are providing unpaid caregiving responsibilities are doing so for spouses. We happen to know that the average caregiver spends well over $10,000 a year out of their pocket taking care of their loved one. So when you couple escalating healthcare costs and reaching into your pocket at a tune of $1,000 or so a month, and you don't have a job to make up that income, it's a recipe for disaster. And unfortunately, we are seeing it play out every day for those that are struggling to make ends meet.
Yeah, no doubt. Healthcare costs a big hit. I was surprised to learn when I was doing some research on this about debt for older adults that 60% of the student loans across the country have been co-signed by older adults for their children or grandchildren, 60%. So that puts them at another disadvantage, obviously, to move forward. Peter, Preston, any thoughts about these other stresses?
Absolutely. We just published a nationally based study on the issue of perceived financial vulnerability. So normatively, how are older adults feeling across the country? And 65% are at least sometimes anxious about their finances. And over half wish they had someone to talk to about their financial decisions and transactions. So they're feeling pretty lonely with their finances. About a third were fearful of losing their financial freedom. And about a third felt like they were treated with less courtesy and respect during financial transactions than others. So there's just a lot of financial angst. And it's so integrated, as Larry was kind of alluding to people's mental and physical health as well as wealth loss. So the prediction of perceived financial vulnerability was their prior rates of depression, wealth, and health physically. So
Yeah,
Yes,
staggering numbers. Yeah.
uh, all of this is spot on. And Joe, to your point, not only have the older Americans co-signed on younger generational debt, school loan debt, there's a considerable amount of the older population, particularly over 50, that still have their own school loan debt and taking this into some of their 60s as well. So that's a dynamic in of itself. Also, too, for those that health care costs affects those that don't have many resources, but also affect people that do. And we see this in the tendencies, research shows that the tendencies of those with enough resources, even after medical care, don't spend the accumulated wealth that they have out of fear of not having enough for health care for 30 years.
Wow.
So even rewarding themselves from their wealth accumulation, they tend not to do that. They tend to distribute that wealth at a lower pace.
Yeah. So Preston, in terms of your focus, what Peter was saying about the research, people looking for some direction and support and guidance, I was surprised to learn about the Financial Therapy Association. And that's where I first saw your name associated with that group. Tell us about that. A mix of therapists and financial counseling?
Yes. So financial therapy is the cognitive and the behavioral and the psychology of money. They're dealing with those three tenets and the intersection of those dealings with money. And uh, there's two ways to approach uh, the Financial Therapy Association. You have the clinicians, like Peter, who when there's actually a condition that you have to deal with money, there's some trauma, stress, to health issues. Okay, we need a clinician that specializes in financial, uh, life and marriage, therapy. So that's the clinician side, and then there's also the practitioner side for the financial planners that they use tools of assessment. They're not necessarily going through the clinical process, but they are using tools like say. Um, there's the client's money scripts, these how to interact using different theoretical frameworks in order to converse with the client in a way to bring out some of these barriers to finance. So that's what the financial therapy is all about. And there's actually a certificate called the Certified Financial Therapist Level 1 that really just came out last year, actually. So you can get certified in this area.
Really? Yeah. Well, it's
Yes.
good to know about that. We've got to keep getting the message out. So we'll do a shout
Yes.
out to the Financial Therapy Association. Yeah, thanks for sharing that. How about the caregiver burdens then? Larry, you're really immersed in this. How heavy is that burden for family members that really are taking care of a spouse or parents?
I mean, it's unbelievably burdensome in virtually every way you can think about it. The impact for those that are struggling and balancing the employment aspect, right? For those that are still working, we see them suffering through loss of job promotion, loss of additional skills as they don't have time to learn additional skills. Those that are shift workers who say, I can't take additional shifts So the burden on the income side is clearly evident. The burden on the retirement savings, therefore, right? When the income isn't there, they don't have the disposable income to put more away for retirement savings. And they've got that point that I mentioned earlier of spending on average almost $1,000 of net pay a month. It's sort of the perfect storm, if you will, in not having the opportunities. And the impact isn't just, Joe, on the employees, right? The impact is on the employer also. And we talk about lost productivity. We talk about what does it cost the US economy. And so when we talk to employers and their employees about the benefit of providing services to take away the isolation, to help on the economic side, right, and to really provide what we would call good guidance, it's good for everybody. It's the alignment of employers, employees, caregivers, and their loved ones. And when we can provide that for them, we can minimize what is that incredible financial burden for them.
Yeah, that's an important partnership, right, with the employers, because they're also vulnerable to all of this kind of distress with the older adult decline. And,
You know, it's interesting. I would only add that during the normal, let's call it the pre-COVID world, right? We had about 40 million unpaid caregivers in the workforce. And that's an astronomical number. You're talking about 12% of the population. During COVID, right, when all of a sudden emergent caregivers became the thing as kids were sent home from school, and if you had parents or loved ones who were living in assisted living facilities and were healthy, you figured out how to get them out of a nursing home or an assisted living and bring them in. That number ballooned up to over 100 million family caregivers in the workforce. So now you're talking about 1 out of 3, right? If we use 350 million Americans, you're talking about 1 out of 3 people is an emergent daily caregiver, spending on average, because of COVID, almost 10 hours a week more on their caregiving responsibilities. When we talk to employers and we tell them this is both good for you and for your employees, it's those types of statistics and numbers that really help drive that story, that it permeates every aspect of our society.
yeah, that's an eye opener. 1 out of 3. That's staggering. Sure.
And I would say that has a multiplier effect as well, because that's cross generational. When you have that caregiving effect, that has an effect on production overall, whether it be household production or economic production, where that person, that caregiver, and they're not transferring services over to the younger generation, because not only are they trying to take care of their own daily lives and the generation back, they're taking care of the generation forward as well.
Yes.
So that's as you mentioned, Larry, that's an economic effect across the board.
And our current research shows that a little under 65% of these caregivers are reaching into their savings to provide that care. So now think about, Preston, to your point about the multiplier effect. You're not earning, you're overspending, you've got no opportunity. You don't actually even see where the light at the end of the tunnel is, right? And we can talk about the elasticity of when we get back at some point to whatever normal looks like. But for these folks that are missing out on either prime earning years or significantly impacting their prime earning opportunities, I don't know what that rebound, I'd leave that to the financial advisors and Preston, folks like you, to figure out what the impact of that is overall, but it's certainly incredibly costly.
Yes, agreed.
Yeah. And then the hit on the residential, retirement, long-term care communities. Obviously, if people are being taken back home, that's less income for the facilities. And you wonder, are the families going to get so used to managing mom or dad or spouse at home, they decide to keep them at home, kind of like people who are working from home, they may not need to go back to offices after they find it actually works. So maybe families are going to find a way to manage this. So we wonder what post-COVID is going to look like for all of these caregivers. Are they taking on, getting better at all these new skills? Yeah. What do you think, Peter? We're going to have nursing home shortage?
I think we're going to see shortages in continuing care communities. I'm not so sure nursing homes will be that short because of the real extreme frailty that occurs, but definitely in these continuing care communities, independent living. I just wanted to say, Joe, that the one thing that we want to make sure to hit on in caregiving, especially of older adults, is Alzheimer's disease and related dementias, and especially early in this process. And uh, caregivers are seeking help and information from national organizations about finances. How do I manage somebody else's money? How do I figure out whether mom or dad's been scammed and the savings are gone? Um, how do I even talk to them about money? It's such a taboo topic. And those are some of the things that we've tried to provide some trainings for on our older adult nest egg website, because people are just starved for this kind of information. It's one little piece of what Larry was talking about, but early dementia, way before it becomes significantly noticeable and so debilitating, is really associated in many cases with wealth loss. And so we're really trying to figure out how can we get some early warning signs. So not only are these caregivers dipping into their own pocket, but the people they're caring for, that they might be able to use some of those resources for, are having those drained before
Yes.
the caregiving really becomes heavy.
Well, wealth loss. So we know there are financial challenges. I mean, even for healthy seniors and managing checkbook and paying bills and all of that. But Peter, you're very close to the other kind of cognitive changes that take place with the dementia process that leaves seniors more vulnerable to their financial, wherewithal and taking care of that. And the warning signs, as you said, really just, I mean, wealth loss, I haven't heard that term, but that's a big term, big umbrella term. So what does it look like operationally? What do you see?
A researcher named Agrasani looked at the health and retirement study and found that people who had lost 10% of their memory scores over a 2-year period had a corresponding 15 to 18% loss in their overall wealth. So that was kind of staggering. And that prompted me to start a new study in which people with perceived or mild cognitive impairment are giving us access to a year's worth of their checking account statement, so that we can kind of come up with what's it look like on the ground in terms of what kinds of problems they're having, what are they not noticing, how are they getting themselves in trouble, what's an early warning system. So we're working on that now, and some of the things in general, what I notice is it's a lack of mental flexibility. People don't change, even though certain things start to go skyrocketing. They don't go shopping around. Even if perhaps they're losing some income because of a death or something, they're not adjusting financially to what's going on. And so they're putting themselves behind the 8-ball.
Mhm. So the warning signs you would ask caregivers to look for, and not just caregivers, but adult children or other spouses, what are the warning signs that, hey, we better take some extra precautionary steps here? What would you say?
Yeah, I think it's really important to have these difficult conversations and be non-threatening and talk about how do we want to stay safe financially? How do we want to keep our financial health? I think you need another pair of eyes on these accounts, because the things that happen are people might become obsessive shoppers. They might be getting involved in a scam. They might be forgetting to pay bills and starting to get big fees. Those are some of the things that are so clear once you just take a look at a statement from a couple of months. You say, what is this?
And what also plays into the dynamic too, and I have this conversation with my clients all the time that are dealing with multi-generational issues. Uh, you know, where are the kitchen table talks? Okay. I mean, that's one of the things that, and particularly when you get 3 generations, you have the younger generation and then maybe the Gen X, which is the sandwich generation, and then the older individuals. They communicate about things differently. I think Larry said something about taboo earlier. This shouldn't be taboo, and we're trying to get, as a profession, even on the clinical side, on the the LTC side, and on the financial side, and all that, to have more of these interactive sessions, particularly financially, so we can learn what older individuals are going through. But you know what contributes to that a little bit is individuality, independence, freedom, dignity. I listen. I know we all have older folks in our family. They're just not coming to you offering that, right off the cuff. You know, so they need Peter mentioned, we need a safe, trusted space, and say, okay, let's not wait until we have that extreme cognitive decline. I'm talking to my folks right now. They're young, as far as I'm 42. They're 62 and 63, so they're relatively young. But we're having these kitchen table talks now.
It's interesting. I'd only add that one little personal story and then a little professional piece of it. So as I said, I'm a caregiver for my father and my parents, and I'm a professional. I do this for a living, right? So you would think that the dynamic of me doing this and providing advice and speaking to people all day, every day about the caregiving dilemma would really prep me for this conversation. And I've been providing financial advice of sorts for my parents for 25 years. When my father slipped into what was his initial caregiving episode, he had a long-term care policy, so money was not an issue. Okay, but as we all know, there's still conversations around finances that matter. Even when somebody else is picking up the tab, there's lots of other conversations to have. And I have to tell you, I thought I approached the conversation with my mother well. I thought I was building on and helping and being a good son. And her reaction was amazingly visceral. She had her back up. She fought me as if I was trying to take control. And we talk about it now. This is now 15 years later, and my father fortunately recovered and everything is fine. And we talk about the lessons learned in that. And Preston, you're spot on in saying you can't have enough of those conversations, and they are unbelievably emotional. That's probably the most important thing. When I do public speaking around it now, and part of this Care Scout service we provide is this sort of compendium, this learning library of how to have these difficult conversations, whether it's the financial piece or what I would say is the most third rail conversation that I think many of us have had is the taking of the keys, right? That's a conversation that never goes well. There's almost no aspect of that ends well. When I talk to people about it and I tell them, you've got to try and be as, early in the process, Preston, to your point, not react when it's time, but have eased into that conversation. It always brings me back to the fact that here I am giving people advice of which I wish somebody would have given me, because it went as poorly as something could have gone. And boy, was it embarrassing to talk about it at times, but it's the reality of caregiving, isn't it?
Yeah, and we do want to respect, we don't want to respect their autonomy, and, we also want to protect them from making the wrong decisions. And I know, Peter, you've written about that a lot. How do you maintain that balance? Because if mom wants to spend $5,000 on whatever, something frivolous, does she have the right to do that? We want to step in. Mom, that's not the right thing to spend money on. How do you balance that? What do you tell the adult children?
Right, it is a balance, and Larry mentioned control, and that's exactly what doesn't go away. That wanting to control one's own life and one's own decisions stays all the way through the end of life. And autonomy versus protection. When do you promote autonomy? When do you promote protection? And I think it's about informed decision making and getting around that. Okay, you can buy this. Do you understand what it is? Do you appreciate whether there's any risk to it in terms of the 5,000 and what you might not be able to do with it otherwise? Those kinds of aspects really give you a window into the cognitive processing, and that can be very helpful, I think. What we found too, though, is that people's just vulnerability, I mentioned psychological vulnerability, but also maybe relationship strain or conflict around money are also impacting so much of this. And in families, the one thing that is also kind of a wet blanket over these kitchen table conversations is the issue of financial entitlement. Now, some adult children think of that as their parents' money as their inheritance and that they should be able to start using it now. And you and I know that is theft, but they don't seem to get that. And so, as a lot of the older adults say to me, and when I ask them Peter, if my kids knew I had money, they'd want some of it. So I don't tell them anything.
Yeah.
Yes, and that's like using caregiving as a medium of exchange, right? It's a
That's right.
negotiation. It's like the older person is not going to give a whole bunch of revelation of how much they have because they do want that care in return, and then the caretaker, or caregiver says, okay, well, I'm going to give this service because I'm expecting something in return, and it should not be a medium of exchange. It should be a medium exchange of love and care that we have for
Right.
one another. And like
I'm sorry, Preston, go ahead.
oh no, I was just going to piggyback off of what Peter said, which was, when defining the family dynamic, uh, it's almost too late when you get to the point of where you need to be having these conversations, because I'll give myself an example. Being a 42-year-old person with young 60s parents, we've either ironed past things out or we haven't, and we're not even talking about the money dynamic.
There's no way. Yeah.
So if we have a healthy relationship, then we can transfer that to the money conversation.
Yeah, I'll tell you, the even added complexity of this is we're talking about it as if there's a single caregiver in the picture. The reality of it is there's often, more times than not, right, infighting among either children, right? It's who's the primary caregiver and who's the secondary, who's making those decisions. When there's competing forces that view that money differently, to Preston and to Peter, to your points around that money. What if you've got one child who's doing really well financially and one that's struggling? That extra dynamic, which, by the way, permeates every aspect of caregiving, whether they're people of means or people who are struggling to pay their bills. People default back to who they were when they're kids. And we see in caregivers that family dynamic is incredibly powerful. It is the most powerful of all emotional poles, at least in our experience.
Yeah. Yeah. So the conversations are so important, and respecting that decision-making capacity, and recognizing they need some control. We all want control, and how much can we give and take on that? So
If I could just add one more thing on that, which is the conversation itself. A lot of this is about framing, and particularly when you're talking about risks, financial risks, whether it be protecting human capital, whether it be protecting financial ruin from long-term care services. We have all these uncertainties, and how do we frame these so they connect with people? How do we frame them? And it's really about the loved one. It's about care for others. You have to have compassion, empathy of her vulnerability here, right? And if the family is not approaching it from that standpoint, then we have all these factors that are integrating with one another. But at the base, if we can frame it and engage in it as care for a loved one, then that's the most healthy environment that you can have, and then we can go about going getting the care and love that we need for our older ones. But I don't think it starts there originally a lot of times.
It's an interesting point when you think about the family caregiver in general, right? Some do it out of love and respect. There's no question that there's a familial, not obligation, but a want in many cases. And we generally, when we talk to caregivers who have chosen to be caregivers, we of course find much less stress. There's what I would say almost a peaceful, even as they progress through some of the more debilitating diseases for their loved ones. Unfortunately, the vast majority of caregiving that comes with stress is when the loved one hasn't prepared for the cost of caregiving and aging, right? So the family caregiver that's doing it isn't necessarily doing it because they want to. They're doing it out of a sense of responsibility to their loved one, but it comes with significant strings attached, right? It comes with resentment at times. It comes with, we know the burden of caregivers. If you feel like you're sort of locked into that, right? Especially as somebody progresses through a disease, we see the stress and anxiety, which manifests itself into incredible mental illness, right? We see that start to climb accordingly, and that's why we're so involved on the sort of the education and awareness of preparing yourself for that situation, so your loved ones aren't put in this really sort of painted into this corner where they feel they've got no other choice.
Mhm.
So I'm wondering, the audience for this meeting, this discussion, will eventually be older adults, families, caregivers. And in the middle of this pandemic, obviously, we're all hit hard, and some of us more so than others. So what do you recommend? How would you counsel the senior, the older adult, and help them get through this difficult, really stressful time, especially if they're hit financially with losses and bills and maybe unemployment? What do you say to the audience, the viewer who's listening here? They want some guidance. They want some uplifting message. What do you say?
Joe, one of the first things I want to say is that in your opening, we've actually been asked to do some research just on exactly what you're talking about during COVID, older Hispanics, non-Hispanic Blacks, and non-Hispanic Asians, and mental health throughout this period. And what we found is it's really tied to food security and income security and expected or actual job loss. All the things you were talking about, these are incredible stresses, and they really show themselves in a lot of anxiety and depression. And what I would say to people is, you can't simply shut down. You have to find ways to others who are going to support you emotionally, as well as other resources that might be out in the community, because these are tough times, but if you shut down and isolate, it's going to get very bad.
Yes.
Point.
And I would say somebody somebody knows somebody somewhere. Um, Meaning, particularly if you have, and this is why social interactions are so important as you age. And that's one of the first things, or one of the top uh, issues when we start transitioning into retirement, is that social bubble, particularly those that are coming out of from careers. They're used to that social interaction, and then what happens after you leave that? Well, that's why one of the main reasons why people continue working is to maintain that social interaction. But if you do have a community of peers, if you live in a assisted living home or whatnot, which what motivates me, this conversation's already motivated me. There's one right down the street from me, and I need to go in there and introduce myself and offer up some pro bono work to these individuals to do that. So thank you for this conversation, because I'm going to do that. But in that social circle, who is getting the financial advice or the life advice that's outside of the family, if that's not where you want to go, if the older a person doesn't want to go in that route? Try to find somebody in your circle that says, okay, yes, I'm getting some good advice from here, or this resource, as Peter mentioned. So that's one way to do it, because somebody knows somebody somewhere.
Yeah, that's an excellent point, Preston. The importance of network and having that kind of social support. And we know that's one of the keys to living longer, right? The more we have that support network around us, that really adds to our longevity. So times like this, as you say, Peter, it's good to reach out and search for some support. There are a lot of resources out there. We know that, and a lot of help out there. Yeah.
One other thing that it's a real paradox about aging is, honestly, and you know this, Joe, the people over 75 are the age group that's actually doing the best during the pandemic. Overall, there are subgroups that are doing very badly and they need lots of help. But it's the 50 to 64-year-old group that is actually in the most stressed, the most difficulty coping. And we don't want to promote any kind of ageism. Older adults often are doing great.
Yeah, that's a good
Yeah,
point.
I would tell you, I would only add this, and maybe this is a bastion of hope for those caregivers that are struggling. If there is help out there, first of all, there are Fortunately, this pandemic occurred at a time where technology is our friend, right? There's no need to have total isolation between the internet, between blogs, between online support groups. There is virtually a support group for every niche of everything and every idea you could have. You could find some folks that want to do that or can share some stories. And we know that most caregivers feel incredibly lonely. As a matter of fact, Genworth did a post-COVID study where we interviewed caregivers in March, April, and May, and published our results in early June to really get at what we were finding from a consumer standpoint about COVID. And as we would imagine, over 50% of them felt more anxious, they felt more stress. Almost a third of them felt even lonelier. Again, sort of makes sense given that, especially early in the pandemic. But for those that have settled into a routine, right, there is plenty of help out there. And the other thing that I would encourage them, it's amazing to me the number of calls I get on a daily and weekly basis from companies who say, we understand that you have something, you have a service that will help our caregivers, that will help our employees. And so I mention that only because if you're an employee and you need help, your companies want to help. But it's a little bit of a chicken and an egg, right? Traditionally, employee caregivers don't put their hand up and ask for help because they don't want to be perceived as somebody who might not be as vested in the company's success, right? They don't want to make it seem as if they're a short timer or they're going to rush out the door to take care of their loved ones. So they don't ask for help. Because of COVID, employers are now seeking out programs to help their employees, but the employee has to put his hand up and say, I need the help. And we do a lot of counseling to companies on how to survey and get at those employees. And we do a lot of counseling to employees that say, here's the way you go about bringing this to your HR department, to your HR business partner, and talk to them about solutions. So there is help out there for those caregivers that are still working, that are trying to balance and juggle it. Don't be afraid to ask for that help. It's really incredibly important.
Yeah, that's a good point, Larry. And Preston, to your point about spending some time maybe at the assisted living facility or retirement community and, just offering some of your pro bono, a short presentation, maybe some Q&A, and helping people to feel a little bit more secure, or if they don't know if they're doing the right thing, maybe they can find out where they can get some of this help. It's
And to everyone's point that I just heard too is like, even I have to share with many people, no matter where they are in the life cycle, which is planning for your finances doesn't have to be morbid. There are, to everyone's point here, there are, man, ageism is or growing older, is about wisdom. It's about freedom. It's about being, not shackled with, societal norms and whatnot. I mean, people get to do what they want to do. So they may not be struggling with caregiving now. They're more struggling with, okay, what do I do with my financial legacy? How do I transfer to my family? How do I transfer this to, as far as my accumulated wealth, or savings, accumulated savings? People think your wealth is just a whole astronomical number, but just accumulated savings, charitable giving. How do I plug this person back into their own legacy and their own giving to uplift them? That's something uplifting as well, because it doesn't have to be doom and gloom. And if they do have all those faculties and they do have those resources and whatnot, then again, and like to Larry's point, they have to, there's a little bit of self-help here. It's like, it is raising that hand and say, okay, this is how my level of care, because see, people have preferences, particularly in the older space, which is they have preferences of how, their level of care. Do they want level of care early, or do they want level of care later? And that actually influences the long-term care purchase decision, as Larry would attest to more likely. So there's a lot that goes in there, but catch it early, and a lot of that comes into, okay, particularly those that are not struggling with health issues right now. All right, if you have the resources and all that, let's use that as an uplifting factor as well.
Yeah, so planning and preparation and reaching out. And, I always like to talk about this whole notion of resilience with older adults. And
Mm.
you know, the ability to get back up, to step back into the ring when we get knocked down, because
Mhm.
we're always hit with obstacles. We're always hit with detours and bumps in the road. So I think there is a certain resilience that older adults have that maybe the younger generations don't have, or maybe they're accumulating it. I don't know. But to your point, Peter, the 75-year-olds are managing the stress of COVID better than other age groups. I think that speaks to
Well,
this.
if I may, I would to your point, Joe. I was just having this conversation just today for this conversation, which is you look. I am just amazed about. Let's take somebody who's 90 years, 85 to 90 years old. Look at what they have seen, you know, across their 90 years of living. All right. From now, if you take somebody that's, midlife, like 50, okay, that's great. They've done some living as well. And we've had the technology boom and whatnot. If I see a avatar jumping around here 40 years from now on my way out, so to speak, I won't be shocked because I'm prepared for that mentally. But see, the generation that started, that are 85, 90 right now, they weren't prepared, to see what's going on now. This is why they're resilient. They've dealt with, 6 or 7 or 8 wars. They had some of the worst wars at the beginning of their life. So one, two, Nam, Korea, this, that, and the other. Then you had social unrest times 100 than what it is now. Yes, it's some social unrest right now. Technology advances, bear markets, economies changing, a scale and whatnot. This gives them that resiliency, and they did this with families, women's suffrage, all this, and they did this with families and marital dynamics as well. So this is where they get their resiliency.
Preston, it's funny you say that. I'll give you a little bit of a chuckle of a story. I was talking to a caregiver and their loved one, maybe it was 2 weeks ago, 3 weeks ago, on the phone about they happen to be long-term care customers, and we were talking about their long-term care policy, and was sort of explaining some of the things to them. And I asked them just generally, how are you doing? And the caregiver was somewhere in my age, I was guessing mid-50s, and um, his answer was probably how I would have answered. I said, "I'm making do. Like we're getting through this. I never would have thought in March I'd still be here doing this," and lamenting a little bit that life had changed temporarily. And I said to the long-term care policyholder, "How are you doing?" And he chuckled and said, "What, are you kidding me? Your people are struggling because they have to stay home and watch TV. They got 400 channels of TV. They got a a fridge full of food. Could it get any better than this?" And I started laughing, and I said, I guess it's all perspective, right? It's, what do they bring to the table? And I think one of the upsides, if you will, if you could talk about COVID and upside, is I do think that that our older generation are going to end up providing incredible perspective about the pandemic and about what it means. And there's plenty of memes out there that talk about what their generation went through and what our generation is being asked to do now, and a comparison of them. But truthfully, right, they bring a sense of, this isn't some incredible thing. Just be smart. This too shall pass. And that perspective really is, I think, in the long run, going to cement their place as an importance in society, even more so than it has been previously. And I think that's something that's only going to help us, not hurt us.
Yeah, that's a great point, Larry. That's a great point. And role models in a lot of ways that we can look at and say, these are tough times, but we get through it. We push through it. We find a way, and we get knocked down, and we get back up, and we push through it. So, yeah, that's an important message. We just have a minute or two left. Any final recommendations to our audience about overcoming financial obstacles? We touched on so many sides of this, but any final thoughts and insights you'd like to share?
I would like to add something quickly, which is the advent of dual use long-term care and life insurance policies all day long has opened up the opportunity to address the uncertainty risk of living too long or maybe living too sick. So longevity risk and also that, and protecting. Say I'm not a I don't sell product or anything like that, but theoretically, particularly with the Medicaid, having to spin yourself down and whatnot in order to those type of wealth planning approaches. Um, Theoretically, back in the day, nobody should really want to buy long-term care because then you have duplication of services that are going to be taken care of either by the policy or by Medicaid. So now uh, dual policies now outstrip standalone long-term care policies by themselves because you have that one contract addressing two uncertainty risks. But if you start early, then you can start uh, addressing this area in a more financially efficient manner, and then it just transfers to the other cognitive things that we and family dynamics that we talked about.
Yeah, having more tools at our disposal to prepare and plan better.
Yes.
Yeah, I'd only build on that to say, one of the other upsides, it's hard to use again, upside in COVID, but it has forced people to reconcile their savings. For sure that this generation was amongst the worst savers pre-pandemic. And when you look at savings rates today, they are significantly increased as people are buckling down and really saying, what matters? Do I need that new TV, or do I need to really put some money in the bank and get comfortable? That survey that I mentioned that we ran in COVID also showed that 4 out of 10 now consider financial security the most important thing, whether they buy a long-term care policy or they're just starting to put supplemental money away to protect for the inevitable or the what ifs. The outcome of people taking a more serious look at their future, in particular when we know that Medicare, not Medicaid, but Medicare Part A is projected to be bankrupt in mid-2025, mid-2026, somewhere not in the distant future. People taking responsibility, if that becomes the best outcome and sort of the best thing that occurs from COVID-19, we as an economy, certainly as caregivers and care recipients, will be much better off for it.
Yeah, good point, Larry. Thank you. Yeah. Peter, any closing thoughts?
Yep, I think the final thought I have, Joe, is that, financial health, or what's being called in the field now wealthing, has to be one of the areas. Physical, mental, and financial health, they all go together, especially as they age.
Yeah, that's so true. Well, I want to thank you all for being a part of this. We have 3 authorities on this tough subject and no easy answers, but some good advice and I think good recommendations. And I hope a lot of people get a chance to watch this. So thank you for taking time out of your day to be a part of this, and hope to be working with you down the road.
Thanks for having me,
having us.
Joe. Much
Thank you.
appreciated.
Thank you, Joe.
You're very welcome, each of you. Thanks.